In 2019, we were looking for a new corporate medical director. We needed someone knowledgeable, approachable, and who could relate to our vision. The choice was Dr. Craig Barker. Looking back on that decision, it is clear to me that there was divine intervention. The good Lord knew a storm was coming, and we were going to need someone with remarkable resolve and leadership. We needed someone strong in their faith and with a passion for helping people.
All of a sudden, 2020 happened, and we were called on to help the community and the health department in any way we could to provide testing, to provide treatment, to provide guidance, and help the community doctors and providers take care of their patients. I think we've done a very good job. The biggest challenges were, we've never done this before, but we need to get it right the first time. And so specifically, the biggest part was the testing center. When we looked at the group that came together to the testing site, that was a very mixed group of repurposed UMC nurses, the UMC facility staff coming together to create an environment that worked, and then the leadership that just stepped up. It was pretty amazing looking at that group effort because they're not related. These teams don't play together. It's not like we had a practice in the past of how are we going to get UMCP administration and UMC administration and grounds and maintenance and environmental services to all come together and make this work, but we did it in a hurry. I was impressed. Since then, it's been treatment options, trying to decide what's a reasonable treatment option when patients are finding things on Facebook and Instagram and all of their friends are telling them, my doctor gave me this, or somebody said this would work, trying to decide what's a reasonable treatment option that's not going to hurt the patient, and then work through that with the patient in their time of fear.
Dr. Barker was a rock in 2020. He was a beacon of hope. He jumped into the fire with us. He was instrumental in getting us the supplies we needed for testing. He was at the drive-up trailer every day. He was at the command center every day. He helped people get infusion therapy. The city leaders looked to Dr. Barker for help and answers. He swabbed people in his clinic and his own parking lot. Even when he caught the virus, he didn't stop. He was relentless.
Being in the middle of the decision-making that affected a lot of people and having an outcome that we hate losing the lives, we hate the fact that this many people have been sick, but I think we look at it and go, we did the best we could, and we did prevent a lot of major damage with some of the stuff we were able to do.
Mr. Funderburk once noted that Dr. Barker was one part physician and one part pastor. Dr. Barker's videos were entertaining and reassuring all at the same time.
Honestly, I think we can handle whatever's thrown at us. After we saw coming together, taking down any boundaries that were between departments and managing the problem, I really think any problem that comes at us, we're going to take that the same way. Where this is a problem, our group needs to fix it, and we're a UMC health system, and the system came together at every level to take care of what needed to be done. So looking at patient care, looking at care for the big community, looking at care for each other, it just happened. And so I have a lot of faith that if anything else is thrown at us, we're going to respond the same way.
Choosing Dr. Barker as Physician of the Year was probably the easiest decision we got to make for 2020. Congratulations, Dr. Barker. Thank you for being here for our employees, for our patients, and for all of UMC physicians.